me know when I put in mute the computer.
Oh, YouTube started, and I've just gone live on Instagram. So just join me on Instagram.
Softer, and then I do CO2 laser to kind of create this smooth, complete look. But I try to combine, and it's very common for me also to receive patients, older patients that are over 50, that they have had acne scars for a long time, and also they can even have a lot of lasers in the past and they didn't work. So sometimes I do this substitution technique with hyaluronic acid, even with a cross-linked hyaluronic acid. I've been using Restylane Lift to create like this volume that sometimes they're lacking.
You're frozen on the Instagram, so I don't know if
in the Instagram,
yeah, they can't see your face. I don't know. Is it your reception?
Oh, I see you, and do you see me?
We can see a picture of you, but we can't see you talking.
Oh, I see my video.
Shall I? Do you want to like cancel it and then come back in just to see? Let me just cancel you.
Okay.
Okay. This is what happens when you do things live. Okay, I've resent the request to you. Did you get it?
I got it, and I accept it. Give me 1 second.
Yeah, it's connecting. Great.
Now?
Yeah, I can see you. Perfect. Okay. So
super.
You were talking about laser for acne scarring. Specifically, what type of laser are you using?
Well, I'm a very big fan of CO2 resurfacing laser. It's an ablative laser. It's quite aggressive. It's the kind of lasers that you sometimes see online as these scabbing, a little bit of bleeding in the face. It takes a while to fully recover. It can take up to 2 months to have the full recovery.
Wow.
But it's the most efficient one, and that one it's kind of, you need only one session. You just do it once, and you can do some improvements after that in certain things. But generally, it's only one session, and it's quite aggressive in that sense. But the results are great.
What's your protocol for people who have had CO2 laser post treatment?
Well, my post-treatment for CO2 laser, first of all, is a corticosteroid cream. There is a big risk of creating post-inflammatory hyperpigmentation. So what I do is that I also give 5 days of corticosteroids orally, plus cream, plus antibiotics in cream. It's you have to be very careful. And after 5 days, you have to see the patient for sure, and you need to see how is everything progressing, and to be very careful about what you do later. It's a medical procedure. It's almost like a surgical laser procedure. Actually, it's considered a surgery. So, but the results are fantastic.
Someone just said here that they have better results with PRP. You ever use PRP for your acne scarring?
Here's the situation. The plasma-rich platelet, the platelets are a reflect of our health state. If we are smokers, if we drink alcohol, if we have an unbalanced diet, our platelets are not going to be that healthy to really make a good result. So for acne scars PRP, I haven't had a good result, a good outcome. But sometimes what I do is that I mix PRP with hyaluronic acid, and that has given me very.
We were talking earlier about the differences between the products that you have in the Czech Republic and here in the UK, and
Yes.
you had some demonstration items for us.
Well, it's about different brands and different products that here they have a quite big impact. I know that in UK, because I study also in UK, Juvederm is everything. Everything is done with Juvederm. Would you love Juvederm? For example, here we have Yamira. It's my favorite dermal filler. It's from Italy. And this is quite simple filler because it's soft, basic, and forte. It's a cross-link, and you have the whole range of your face treated with Yamida like that.
Did they also make the
Then
Luminera as well? Is that the same company?
no,
Different.
no, 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 no. It's different company. Yes. And then, for example, you love Profilo. You are in love with Profilo. I
Yeah.
like it also. But here we have the Sela Rederma that is from Yalual, that is a brand from Ukraine, that is made in Italy, and that it would be our Profilo. So basically, we have like a different products to make an outcome similar to what you can do, and we have to adapt to our market also.
Someone just mentioned on Instagram about using hyperdilute Radiesse and PRP for skin boosting and acne scarring. I know you're a big fan of Radiesse.
I like Radies. I like Radies thanks to a colleague in Germany that's called Mauricio. He's from Colombia. He has a great clinic in Hamburg, and he's the king of Radies. He does Radies for everything. And I started like getting into the Radies trend, and I got very nice results. And I see that they last longer than the hyaluronic acid, and it's expected for sure. The Radies, it's a different compound that stimulates the collagen production, so it's like a different approach.
I think I've actually gone back to using quite a lot of Radiesse. I kind of substituted it for the Juvederm Volux quite recently, and the incidence of post-inflammatory issues was, reasonable. It was reasonable. So
You need to have like another level of experience to work with Radies, and you need to be very conservative. I try to be conservative with the Radies in certain things, and now what I see a lot in these trends here in Czech Republic, but also in Germany, is this hyper diluted Radies. For example, 1.5 ml of Radies with 6 ml of isotonic solution of like a physiological serum, and that can really potentiate the effect without reducing the risk of these inflammations.
we also spoke before we came on air about the fact that you're not using Sculptra over there.
Yes, yeah, the products related with the Sculptra, it's kind of not allowed in Czech Republic, the Sculptra product by itself as a drug.
Yeah.
So we have another product that is called Elance Sinclair that is like a bomb because it's the Sculptra plus hyaluronic acid plus calcium hydroxyapatite, and it's a dermal filler that is considered semi-permanent. I got my certification from Croatia to do Elance, and to tell the truth, I've never done it. I learned how to do it. I know the products, but I haven't never done it because I have read some reports that it's a different field that I think that it's a little bit more dangerous. I rather to stay conservative in that sense.
Yeah, actually, I haven't used it myself either. I did the training and then decided it wasn't
You too,
wasn't for
the
me.
Lancet.
Yeah,
Yeah,
yeah, because
because the training is fun. I had a lot of fun with the Lancet training, and the doctors are great. But then,
I in the end I didn't use it because I saw a few nodules from somebody in a different clinic,
the
and I
granulomas,
thought,
yes, yes,
no, I'm not gonna use that.
exactly.
We've got a question here about having Fraxel and then having hyperpigmentation afterwards. Do you have any comments about that? Because you do quite a lot of CO2.
It's one of the most common side effects, and I deal with that also. I have had patients that have developed post-inflammatory hyperpigmentation after refraxel. So first of all, we need to be very conservative, and second, we have to understand that the post-inflammatory hyperpigmentation is not permanent. We can manage it. Actually, I, I'm dealing with a case right now, being totally honest, in which the patient, phototype 3, 4, meaning a lady, brunette, darker skin, got the Fraxel. The procedure went fantastic, improved a lot the skin quality, and after like 2 months, created a mild hyperpigmentation. And that we can treat it with hydroquinones, home use. Sometimes I do some Q-switch laser to even reduce this hyperpigmentation. We can manage it. It's not as severe or it's not a permanent condition, and we can manage balance. We say, okay, what is the improvement that I got compared with what really got as a bad result? You can really manage it. It's normal. It's normal, but it's manageable.
Someone's just asked, what's the best solution for skin prone to whiteheads? So I'm going to throw that over to the dermatologist because I have my protocol for that, but surely you must have something specific.
For
Yeah.
whiteheads, okay, this is going to be a little bit controversial, but
Oh,
I
it's fun.
yes, there is this whole concept that popping your pimples or your whiteheads, it's bad. It's absolutely bad. However, I do it with special tools and with a clinic grade safety to pop up and clean up your whiteheads. And then I follow up with something called the Ener peel, that is salicylic acid peel, plus a regimen in whole. So I'm not a big fan of keeping the whiteheads there because they create fibrosis, they create even more post-inflammatory hyperpigmentation. You are keeping there the even the infection there, the bacteria accumulation. So my protocol is that I probably our viewers know Dr. Pimple Popper. She is a doctor from the New York. I was very lucky to meet her, and I got a training in New York with her. So I have here tools for Dr. Pimple Popper in the clinic where I work. So I literally I pop the pimples. I pop the pimples. I clean. I do ultrasound deep cleaning, and then I do an inner peel salicylic acid until I see frosting, meaning that you see the face like with this white thing, and not the precipitation of the salicylic acid, but the real frosting. And I have received very good results with that.
You mentioned an ultrasound tool that you're using there. What tool is that?
Yeah. Yes. Well, it's a type of cleanser. I don't want to say fancy, but it's like the cheap version of the hydrofacial.
Ah,
It's
okay.
like
Yeah,
a
yeah, yeah, yeah.
portable. It's like a portable ultrasound that really is capable to kind of push the oils and all the dirt inside your pores to the surface. So that's what I use. I really like it. My patients really like it, and it's very effective.
Someone else asked about any vaginal hyperpigmentation. Is that something that you treat?
Yes, I do also. Well, it really depends on the. Uh, it is totally possible to do lasers, Q-switch laser. There's protocols to reduce the hyperpigmentation in the genital area. I do treat a lot of males, especially Indian males and Indian females that underwent epilation in the genital area, and then they treated this hyperpigmentation in the groins. So I do it with Q-switch laser for a specific setting for people that phototype. And also, I do it with chemical peelings. There is a very nice peeling called BioReb, that is tetrachloridic acid. That's called the BioReb body, and that requires 3 sessions. The problems with the groins areas and the genital areas is that a chemical peeling can be very abrasive and it can be very uncomfortable.
Yeah.
Can be very uncomfortable, but it works. It works beautiful and it's very safe. So it is possible.
So actually, I've started using one from called Happy Peel, Happy Peel, which is specifically for that indication as well. It's TCA as well.
Yeah,
I
yeah.
imagine it's the same.
Yeah, basically that's the funny thing. We are like different two worlds between UK and the West Europe, and we Central Europe and Czech Republic and East Europe because we have a lot of products that they are basically the same. You call it the Happy Pill, we have the BioRep Pill, you have the Profilo, we have the Celeraderma. We have different things that they have like a. The outcome is basically the same, and the quality also can be the same.
Yeah.
In that sense.
Someone's asked about treatment for hyperpigmentation. Any product recommendations?
Well, if you're gonna do home treatment, for sure you have to use everything that includes vitamin C, that includes glutathione, that includes antioxidatives. Sorry, the what's the name of this acid? Mandelic, some lactic acid, all these soft acid that you can use home treatment for the treatment of melasma or hyperpigmentation. When I do it in the clinic, what I do is that the hyperpigmentation is treated with mesotherapy, again with products that are against hyperpigmentation and chemical peelings.
Somebody's asked for a female that has shaved her face for laser but now has a shadow in the beard area. It sounds like hyperpigmentation, so the treatment for that would be the same as well.
Kojic acid, yes. Harmony biloba is a perfect kojic acid. Sorry, she was correcting me. I've seen the comments. Shading with the male shading, sometimes it's not the hyperpigmentation. In males, when you do the the epilation with any type of laser, alexandrite, diode laser, or even IPL, you can keep some kind of deep pores that keep the melanin inside. It's like the follicle of the hair, and it's shadow more than the pigmentation. Pigmentation has to be brown. When people tell me I have pigmentation, okay, it has to be brownish looking, patchy, and if it's like a black coloration or like a bluish coloration that I see in males, that is basically that there is still remnants of the hair in the follicle inside your skin. So for that, you do another type of laser that is called Nd:YAG, or I do sometimes alexandrite laser to remove these deep, coarse hair follicles that are still keeping the black pigmentation. But that's different, and it has to be evaluated.
Someone's just asked if you're practicing in London. No, I
No,
wish he was.
as Sarah, no, I practice in the Czech Republic in Prague, in a clinic called Altos Clinic. But I'm also a researcher, so I'm like separated in two worlds.
Yeah, I was very impressed when I found out exactly what you do. Actually, Alberto. I mean, this man's, you know, you've got an MBA, a PhD, which he learnt Japanese for to write his dissertation. Like the man learnt another language just to write his dissertation in it, and it wasn't like French or something straightforward. It was Japanese.
Yeah, I
That's
love
insane.
Japan.
It's so
I have a lot.
insane.
I have a deep love for Japan, and now I'm Czech Republic, but I don't speak Czech yet. I'm in that process. The process is
So,
learning
how many languages are you speaking?
Spanish, English, Japanese, some French, some Italian,
Insane.
and I'm in the process of Czech. Basically.
Insane. That's crazy. Really, that's crazy. Did you see the question about better laser or vampire facial to get rid of pigmentation? I mean, PRP is not going to really help with that.
No, no. PRP is not going to help. That is for sure no. The PRP is not going to alter the pigmentation. There are some studies, and I do it sometimes with people with phototypes, higher phototype 5 or 6. I receive patients from Nigeria or patients from Uganda that they have a lack of uniformity in the pigmentation, and they have hyperpigmentation, but it's difficult to see. So what I do with them is a protocol called redermalization, in which I inject a small amount of hyaluronic acid with succinic acid, and that kind of equals. It's like an equalizer of the pigmentation around the face. But injectables for hyperpigmentation, it's a little bit difficult. About which is the best laser really depends on your skin, your phototype. It's sad what I'm going to say, but also depend on your budget.
Yeah.
Because, for example, if you get IPL, it's going to be way cheaper than having an alexandrite or some kind of diode laser or Q-switch laser, and also chemical peelings.
Oh, great question there from Kish. Do you see that?
If I'm using tranexamic acid orally, tranexamic acid is not allowed for prescription here in Czech Republic for this kind of for that type of treatment. The regulation of drugs in Czech Republic is very unique and very specific. So we have a lot of restrictions about what we can prescribe. So we need to kind of move around and find the best options that could be also legal here in Czech Republic. For example, hydroquinone creams here are not legal except if you make a magistral receipt, meaning that you create the prescription to be prepared in the pharmacy, but there is no pharmaceutical selling a pre-prepared, a pre-made hydroquinone treatment. And actually, all our peelings have to be hydroquinone free. I have here one peeling called the PCA for Czech Republic. You have PCA also in the UK, but this one is the hydroquinone free. It has to be. This is the only one that we can have in Czech Republic.
So what, you can't get any hydroquinone? Did I just misunderstand that?
Except if I prescribe it under magistral receipt. Do you know what's the magistral receipt?
No.
Magistral receipt is when you make a prescription in which, like old school from the 80s, you write down the components, and in one pharmacy they prepare it for you with those components.
Oh, like a compounding pharmacy.
Compounding. You call it that in the UK.
Okay.
That calls here is called magistral. So it has to be compounded, and it has to be it's very regulated. We need to really be cautious about how we do the compounding. It cannot be more than 4%, and the amount is very limited. It cannot be more than 2 weeks. It's like a whole
2 weeks. History. You can only do 2 weeks. Wow.
Yeah, and then I can extend it, but I have to go through a whole thing to send a special certification to the government for them to renew the prescription and blah blah blah. So hydroquinone. So it's the same with the tetraxamic acid.
I just had a question on YouTube about what you did for your PhD research.
Oh, well, I was studying metabolism, especially the platelets. I'm very interested about the platelets and how the state of our platelets are a reflect of our health lifestyle. I was studying metabolic syndrome, meaning being a little bit overweight, have some mild hyperglycemia, have some mild hypertension, and how this really affect the platelets, and how these platelets affect from one side the atherosclerotic process, how we create cardiovascular disease, but at the same time, how we create problems in the wound healing and the skin state.
Wow. And what did you find?
I found that basically what we do is reflecting our platelets. I mean, if you have like a vegetarian diet, your platelets are rich in very good anti-inflammatory lipids, mediators that really can improve the wound healing, the response to blood circulation. But if you really smoke one cigarette, your platelets are overactivated or they're downactivated, or they are poor in fatty acids that are important. So I am the kind of guy that uses PRP only for one thing, that is hair restoration, and in very specific cases for face. But before doing it, I put the patient in a protocol of healthy lifestyle for 2 weeks, plus no cigarettes, plus no alcohol. So I have to control the patient before, and I don't do it immediately. I have to say, hey, you need to be healthy to have this.
What PLP device are you using?
I'm using the T-Lab. I think it's my favorite one is from a Turkish brand. Probably you don't know it because I don't know if it's in the UK, and it's a package that includes everything, and there is this misconception that super expensive centrifuge are going to make better PRP. No, the centrifuge is the centrifuge. You can have the basic centrifuge and it's going to be okay. It's about the tubes and the proper coating. So, for example, in the past, I used to do with heparin coating, and now we know that heparin is the wrong way to do PRP because it binds to the receptors in the platelet surface and removes the activation of it. And then we now figure out that citrate is also not good, so we have a special T-Lab company has a special matrix silica coating that maintains the platelet not activated. So it's about how you obtain the platelets more than the centrifugation. Centrifugation is kind of irrelevant.
What's your opinion about other devices such as the Angel or the Magellan, which are not centrifuge?
To tell the truth, you can have a super fantastic. Sorry, I have a small question here from Harmony. That's very interesting. No, you don't activate the platelets. That's the idea. You don't need to activate. You need to have deactivated platelets. And about your question, you can have a super fancy machine. I have seen them. They were fantastic. You have a high rate of recovery of platelets, a high level of purity, a high level of inactivation. But if you are unhealthy and your platelets are not in the right way in your system, the outcome is going to be very unpredictable. You're not going to know what you're going to have. You might have red results, you might not have any results. So for me, platelets is like, you need to know your life. You need to be honest with yourself. I tell my patients, do you smoke? No. And then they write in that amnesis, one cigarette a week. I say, yes. You smoke? No, but it's one a week. It's smoking. One is smoking. And I'm going to tell you, this is not going to work. It can be great for the business. I can have you here for 5, 6 sessions of PRP, but it's not going to work. It's not going to work.
Sandy, no, this is my wrong hand. This one's old. Come on, how many times have we seen each other now? Somebody.
Yeah, Dr. Kish loved the PRP for teeth loss. Sorry, Dr. Kish loved the PRP, and you also for teeth
I
loss.
do.
Yeah, it works. It works fantastic. But honestly, I use the osteal density too, and it works good. I mean, the people wants to have not this dark coloration, and we can make it work.
Well, I think we're doing it mainly for crepey skin. So, if the patient's got poor skin laxity here, they failed the SNAP test, then I like to do PRP or mesotherapy first to try and tighten everything up so that they've got less risk of edema afterwards.
For that, I do CO2 resurfacing. For this crepey skin or the laxity, it's a little bit invasive because I have to put like a metal shield in the eye, inside laterally, and then I do a whole laser around.
I mean, this is something that we were speaking about before, because I think different countries, they will tolerate different procedures. There's not a chance.
Yes, absolutely.
There's not a chance that would be tolerated here. No way is anybody letting me stick any metal, whatever, in their eye. It's not happening.
Yeah, here it's okay. Here I just put the metal and then I just put the laser around, and you look like a raccoon for like 1 month because you get super red and swallow, and that's fine. They go party. That's okay. That's okay.
That is not going to happen. Somebody's just asked if can you spell the name of the tubes that you're using?
TLAB. TLAB.
Okay.
And I have a question here. Sorry, I want to answer because it's from YouTube and it's very linked to this. Is that somebody's asking if the exercise affected platelets? Yes, it's a very controversial thing. They have evaluated high performance sport people, and they have athletes, and they have seen that the platelets are also reduced, and they are very low activated. So the extreme exercise is also not so good. And they have seen in people who do a lot of bodybuilders that the quality of the platelets is also affected in the bad way. But it's not that because they do so much exercise, their red cells compensate for the oxygen, so the platelets go down a little bit. If you're thinking about a gymnast or a ballet dancer or a yoga, they have seen that the platelets are in a better quality. So the work of the platelets is a big world. I have to say that platelets is a whole Pandora box. We really don't know much yet, and medically we don't know that much yet neither. And that's a lot of research to be done.
That's very interesting. Do you do threads in Czech Republic?
Yes, here is a big trend of threads. Oh, I forgot to bring some threads, but here threads is I think the one of the number 2 or 3 most requested procedure.
Wow.
We have, and I receive a lot of patients from the UK flying to Czech Republic and to Russia to have threads. When people say, they have to understand that there are several types of threads. There is the cosmetic thread, that is called also the mono threads, that I have seen you doing a lot. You do in the neck, I see one by you that you did. Then there is the double needle thread that it's more like a speculated that can create literally a lifting. It's insane. You can really create a whole facelift. And that is way more invasive. That is way stronger. And I am in the level, personally, in the results that I like, I do more cosmetic soft threads. I feel that the price plus the benefit plus the risk of a big lifting with double needle threads is not compensated, and you can spend the same with a lifting, with a face lifting. For example, you want to have the silhouette lifting. I do the silhouette lifting. However, you have your own. You need to be in very, very, very expert hands.
Mm.
It can go very wrong very fast. It can go south very easy. And so for me I do it in very specific cases. You need to evaluate very detailed your patient because not everyone is candidate for threats. And that's something that you need to have in consideration for all this. And actually, sorry, I think you're not a good candidate for silhouette lifting.
I don't want it. Stop trying to give me.
You told, yeah, you say
No, I didn't.
in your last video, you say that when you turn 40, you want to have the silhouette
No, I
threads.
said I want a facelift.
Yeah, but the silhouette lift.
No, like a surgical facelift.
Ah,
Yeah,
because I was thinking she's not a candidate
yeah.
for this because you have so much fat pads and your muscles are quite bigger. You cannot
Oh,
lift all that. You look like crazy
all
with
right.
that.
Let's keep it clean. Let's keep it clean.
Yeah, okay, no threat,
Do you do the
no
Do
threat.
you do the monos as well, the short ones, or you
Yeah.
just do? Okay. Do you like the monos?
Mm.
Meh.
It can make. I started create some lift, some more turgency, some more like a strength in the skin. But I found Ultera, and when I found Ultera, I fall in love, and Ultera changed for me everything. And I rather to tell the patient, you know what, it can take longer, but you're gonna look better. It's gonna be less invasive. It's gonna be cheaper. You're gonna be everybody's saying sell it.
I
Sorry,
know.
yeah. Um,
He is, isn't he? Total savage.
I steal all your videos. I know all your videos. So I know that you say that. I'm gonna show the receipt. Show the receipt. I know it. Show the receipt. You want the silhouette, and you say that you want to have also your butt lift with Dr. Aslani. I know this.
Yes, I was so surprised to hear that you know
Yeah,
him. That's amazing.
yeah. I know him for sure. He's fantastic. So the Ultera for me, it's my life changer. So I'm doing very little threads, mono threads, and I'm doing way much more Ultera.
Okay,
Ultera is my.
so I have to tell you, I just tried the new ultracell machine,
Mm-hmm, mm-hmm,
and I've had Ulthera as well, and I
mm-hmm.
thought the new ultracell was much better. This is not the old ultracell; they brought out a new one now.
Yeah, of course, the technology is growing, the technology is improving, so we have to stay on the state of the art. I mean, this is gonna get, this is getting growing. This is more experience, more things, more technology. So yeah, of course.
Yeah,
Somebody's asking if we are reading the YouTube. Yeah, we're reading the YouTube, but there is 1 minute of delay.
yeah. Sorry. Somebody said something. Oh yeah. About a mini lift rather than the facelift. Yeah, you know. Oh my God, what's his name? That American plastic surgeon who's very famous in New York. I
Cool.
cannot remember his name now. I'm having a blank. It will come back to me.
Hmm?
But his results, especially on younger people, are fantastic. Like seriously amazing. I mean, he does this like innovative deep plane technique, which I was loving because something that a lot of my patients tell me when they've had a facelift is, oh, I wanted him to be conservative, but he left too much here. Do you hear that? Yeah, I hear that a lot.
No, there is. If you're talking about facelift, going conservative is wasting your
Yeah.
money. I mean, you have to go clinically reasonable. That you need to remove excess skin. I do, for example, neck lifting with a combination of CO2 resurfacing with radio frequency. That is quite aggressive procedure to really remove the excess of skin and tighten up. We have a great machine in our clinic that is at the same time radio frequency and CO2 resurfacing, and then I do Ultera like 2 weeks later. So
That's it. Somebody's just
yeah,
said that. It's Jacono. That's it. That's my man. That's who I want. Jacono. Yeah. Take me to him now, please.
yeah,
Somebody said, can you talk about, oh yes, this question here about the scalp and the PRP. Do you see that?
yeah. I do it on the scalp all over, or if you see me in the top, I do it all over sides. But you need to be super cautious that you're not gonna see anything before the fourth or fifth session. It takes a while. It's a hair growing.
Yeah.
There is, we need to see under the dermoscope first if there is still some kind of sleeping follicles that we can just that it could be awake. If they are, good. But if there is literally nothing there and your scalp is totally empty, you have to go for a transplant. We need to be also very honest with our patients about what we can achieve and what are the realistic outcomes that we can have. When I see a patient with a mild alopecia or woman that they work very nice, I do 4 sessions. I start with 4 sessions every 2 weeks. I take before and after photos. If I see the improvement, I encourage them to follow for 4 more sessions. But and we reach up to 12 sessions.
Do you use a
But
topical, or do you use an infiltration before you do it, or are they just so hard as nails in the Czech Republic that you don't need any anesthesia
no,
at
no,
all?
no, no. I use Embla. I use Embla all over the scalp, and I wait for 30 minutes, and then I will partners wash the hair,
Yeah.
and then we start. But I use. But I have a lot of patients that they don't have anything, no Embla,
Yeah.
that they are fine. Actually, 90% of my patients tell me, no, I don't want anesthesia,
Yeah.
and we do it like
You
that.
know, my Russian patients who have PRP in their hair, they always say that. I don't want anything, just do
Oh
it.
yeah,
I'm like,
yeah,
oh,
yeah,
okay,
yeah, absolutely.
okay. They just don't care. Fantastic.
One of the things is that is really reflect of the market is that most of the products that we have here, the Yamida, the Celaroderma, 90% of the fillers that I use are without lidocaine.
Oh,
We
what?
don't have fillers with lidocaine.
No.
Yamida is without lidocaine. It's just a filler. I do lips with needle left. When the patients are totally okay. My hands are also, I think they're not so bad. They're good. I have never received any complaint. But most of the fillers that we have in Czech Republic are free of lidocaine.
Wow.
We have
Why is
Revanes.
that?
One, the legislation of lidocaine is considered like a drug. So basically, as it's considered like a drug, it should be sold. The fillers should be sold like in a pharmacy, something like that, and not by a distributor. And second, there have been reported more cases of complications related with the lidocaine in the dermal filler than the dermal filler by itself. And that's why Czech Republic and most of Central Europe and East Europe, all the fillers are lidocaine free.
Wow.
I use Estilash without lidocaine.
Wow.
I use Yamida without lidocaine, Revanes, the Celaroderma, all the products from Jowls are without lidocaine.
Wow.
So yeah, and the patients called it very nice. I mean, I haven't had any problem
Yeah, but they're pretty hard.
so
They're
far.
pretty solid over there, aren't they? They're tough.
But I have received a lot of patients from the UK that they know about this and they hold it very nicely. The UK's can make it. The British can make it.
Somebody was asking if you'd heard of a particular filler. Did you see that question? I can't find it now.
Sorry, what?
Oh,
If
you've heard of Regenera, is that a Czech thing?
Regenera,
Yeah.
no, I'm not familiar with that. Regenera, no, I'm not familiar with that.
How do you manage the hate in social media? Wow.
Yeah, very, very philosophical. Okay, it's time for the psychological therapy with Dr. Thomas. Let's start.
I don't know. I normally just text him and say, "You never guess what somebody said about me now."
Sarah, be honest. How you deal with that? You have a glass of white wine and then you say, fuck off. You're the queen of social media.
I don't know. I don't read it anymore. I think you can't read it these days. You just gotta spread the positivity and ignore the hate. I think just block and delete.
Yeah,
Yeah, block and delete.
it's part of it. That was one of my biggest fears of social media. That's why I don't have YouTube channel and my Instagram is very. I feel like super shy about it. So I'm like,
Really?
yeah. But it's okay. I mean,
No, you get used to it.
it's fine.
Actually, some of the comments can be quite imaginative as well. So occasionally, I do actually enjoy reading them.
There is a mental process in that. Somebody asked, sorry for interrupting. Somebody asked, there is a lady that she follows me on Instagram. She's called Inga. She asked me, when is the best age to start with non-invasive procedures for lifting, or the sooner the better.
Yeah.
That's the truth, because you prevent. Here's the thing. In my personal experience, I started having botulinum toxin and fillers at 25, 26 years old.
Yeah.
And I have seen that you can really prevent. Now I'm 33.
Yeah.
You can really stop the aging process. Not stop, but This accelerate, slow the aging process. You could really do it if you start early. You don't need to have a CO2 resurfacing, even when I do when they're 20, but you can have, for example, some nice ND-YAG for collagen stimulation, some nice ultra or radio frequency. So basically, you can have the small things, redermalization that I do a lot, that is pure revitalization, chemical peelings. I love chemical peelings to keep the skin kind of smooth and tighter. So it's for me. I have received patients 18 years old with acne problem, but if somebody 18 or 20 asks me for Botox, I say no, because I found it a little bit unethical. But for me, 25 is the breaking point. In 20, you can 25 you really start aging. That's the truth. You really start aging, and your 30s, you start getting rotten.
Well, yeah, I started when I was 26 as well. And yeah, I agree. I think there are some things that you can do, some little bits of tweaking, even for people who are a little bit younger, because it's easier to treat you now than it will be in, you know, 10, 20 years time. Something that I hear a lot actually is, oh, I've decided I'm not going to have anything done because I'm waiting to have a facelift. Why?
Yeah.
Why?
Why you gonna?
Yeah.
And then they want a natural thing. If you're gonna wait, and then you're gonna go to the facelift, it's not gonna be natural at all. And in my experience, for example, I treat a lot of ladies over 70, 70, 80, and my oldest patients had 92. And I got a patient 92 years old, and I did resurfacing plus filler, pure revitalization. You can make things. You can make things. You can really create things and improve the skin quality, the pigmentation, this granny look. But you need a lot, and you need a lot of resources. You put also a little bit in risk the health, because when you're 92, of course, having a CO2 resurfacing is everything. I mean, you breathe at 92, you're in risk of life, and so you need to do too much. When you're young, you just can make this little twitch, this little here, and then attach up in 1 year, in 6 months, a little here, a little there, and then you can have a good thing.
We got some fights in the comments there, Alberto.
Yeah.
Yeah, but he's not in London, so what are you gonna do, huh?
Fly to your Czech Republic when we have flights, because we don't have any flights.
That's true. Somebody on YouTube said that they're currently losing weight. What would we recommend for keeping facial tightness? Thoughts on facial yoga or facial exercises or treatment? I did see a paper that was in support of facial exercises. Haven't tried it myself though, so don't know. What's your thoughts?
I haven't seen any convincing results with facial exercises. Um, what I have seen good results in younger patients who are losing weight is that radio frequency is working very nice to keep this kind of very subtle skin tightening and not losing not this whole weight going down.
Yeah.
And radio frequency, I do very conservative in terms that is more like a cosmetic. Even cosmetologists do radio frequency, not a medical professional, but they are good. What?
Just laughing at the Instagram comments.
Okay. But they are good. They are good. They are good procedures with radio frequency that can prevent this effect, and I really like it.
I actually prefer ultrasound over radio frequency because you're right. You can lose some fat in the face, but actually with both. With both.
We have a device in Czech Republic in Prague that is called the triactive radio frequency. That is called the cold radio frequency. That is mixed with also with laser. That do not they claim, and I have seen it. At least I have seen it that you don't lose fat of the face, but you only stimulate the collagen in a specific way. And there is a machine from Korea when I went to Seoul.
Ooh.
That is this deep micro needling radio frequency that is like needles that are over 2 millimeters deep. So it's like very deep, and it would not damage your fat. And so the field of radio frequency is also big. It's also huge.
Yeah. I'm running out of battery on my phone, so if I disappear, I'm sorry.
Okay.
I just wanted to let you know. Somebody asked a question about fillers to remodel the face, not for anti-aging purposes. Do you accelerate the aging process since you're stretching the skin?
Interesting.
Comments?
Your thoughts. You
Okay,
first.
I'm gonna say it depends on how much you're putting in. If you're judicious with it, and okay, if you're not crazy, then I don't think that will happen. It's not true because you're going to get all this new collagen formation anyway. Obviously, in cases where people have maybe overfilled an area, then yeah, I can see, particularly if you then go on to remove it afterwards, I can see that might happen. And it's always my philosophy as well that there's only so far that you can go with filler before you then have to start thinking about doing other things like doing ultrasound or radio frequency or even putting some threads in or something like this. What do you think?
I agree to you, but I want to add also one. It's not also about overfilling or overcorrecting, but also the wrong product.
Oh, yeah.
When you're too young and you're adding too thick products and you're creating this voluminization that is with too much projection, yes, you can create this older effect. You can look older, literally. That's why, for example, in younger patients in their 20s, when they ask me for some fillers, more for the skin quality, I do this kind of profilo that we have, the scleroderma, biorevitalization, hyaluronic acid, and I try to keep the fillers the more dynamic as possible. If they ask me for nasolabial fall, I try, but also a very elastic filler, not such a thick or like rigid filler. So I try to combine both things. And also there is this misconception that, okay, Ultera, radio frequency lasers, if you over abuse of these procedures, also you're going to have a lot of damage. I have seen a lot of skin damage by Ultera, overuse of Ultera or too strong Ultera. That's why, for example, when I do Ultera, I do one session and you can have another session in 2 or 3 years. I don't do it closer because Ultera can also create damage. Radio frequency is the same. Ultra frequency, you do it closer session by session. So you need to be conscious about also the clinical outcome.
So I think it depends on the patient as well, because if you're trying to get fat loss, like for example, somebody with my sort of face who's a little bit heavier down here,
lipolytics.
Yeah, you want to do it more often, but I would never do it on somebody who's skinny mini. It wouldn't work.
It's true.
Well, we've had a few. Go on.
Somebody's asking here what we think about the microneedling home use.
Oh, yeah.
Super controversial because when you are doing microneedling, you're creating a lesion. You can be very skilled putting the roller or even the pen around, but what about if in your home you don't have the proper sterility and clean environment? You can infect your skin, you can create a wound. You need to have knowledge of the deepness of the microneedling. I do microneedling very rarely because it's very cosmetic. I do it because there are patients that ask me. But for example, the deepness of microneedling is different in the forehead compared with chin, neck. And sometimes in your home, you're not going to be able to know all these details. There was this old concept that the end point of microneedling has to be the bleeding. But that's not true. Now it's known that it has to be the erythema, and erythema is the redness. So when you're in home, sometimes you're not going to figure out when is the bleeding and the erythema. So I'm kind of have mixed feelings about these home use treatments.
I think most home use kits are not going to be more than like 0.3 millimeters anyway. I remember when I started doing microneedling, we had to, really create. We were taught to really create some bleeding and get a lot of blood going. It was quite a vicious procedure. Not anymore.
But the problem is that now in Amazon, for example, you can buy microneedling machines, not medical grade, but for home use for like 30 euros, and they are up to 2 millimeters.
Yeah.
So the accessibility of these products now for non-medical professionals, it's easier than ever. You can really, really, really make it, have it in your in your home?
Somebody has asked about jowls and how to fix marionette lines. I mean, that's like a whole stream in itself, isn't it? You've got to either tighten the skin or revolumize the face in areas where you've lost volume from. You can fill the lines themselves, but there isn't just one thing that you can use which is going to completely fix that issue.
Yes, yes. In younger patients, I tend to feel the nasolabial fold. I also have had my nasolabial folds filled,
Yeah.
and but always take in consideration if the problem is in the zygomatic area and if we need to lift the tissue, and if this is the real problem or if it's only the symptom of a lack of liftiness here. So it really depends on of every patient, but there are options. There are actually plenty of options.
Someone's just asked as well if you're over 50, a retinoid is necessary if you're getting Botox and fillers. Yeah, definitely, because you're treating different
Always.
things. So,
Yeah,
totally.
yeah, yes.
HA is hyaluronic acid.
Yes.
PRF. I say PRP, not PRF.
Yes.
Can you not treat the jowls without fillers? Yeah, like he was saying, you could try radiofrequency or ultrasound, but a combination approach is always going to be better than just doing, the one thing repeatedly. That won't work.
Exactly. The problem is that there is no one treatment that's going to solve everything. So we have to think about a comprehensive concept that the aging is not only the skin. We have the bone structure, we have the fat compartments, we have the muscle and the fascias, we have the ligaments that they are creating the lift, and then we have the skin. So we have to think about all the different layers to really think about complete rejuvenation.
The best filler for under the eye, it depends what you're trying to treat. If it's volume loss, then I always use TSI Redensity 2. If it's not, if it's skin quality issues, I'm using a lot of Sunicos now. Do you guys have that, Sunicos?
No, but I know it.
Yeah.
We don't have it.
Yeah, I'm liking that at the moment. I think it's good.
Redensity 2 is fantastic for under eyes,
Yeah.
and also use the Yamida Soft, and it works great. I haven't had any issues with lumpiness or things. And if there is bags, I use the redermalization, the Stellar Redermas, because it's non-cross-linked hyaluronic acid anti-inflammatory.
Somebody just asked about hyaluronic pens. You know the ones that.
Hyaluronic.
Yeah. Yeah.
No, that's my comment.
Yeah.
That's my comment. I don't have any more to say.
Like,
it's insane. That is insane.
It's not very controllable. That's the issue, I suppose, that we would have with it. You don't know where you're injecting. You don't know what depth it's going to. Things are unpredictable enough as it is. So, yeah, tricky.
A group of researchers from the Netherlands collected all the yellow pens in the world that are now commercially available, and they created a matrix that mimics the skin. It's like a gel, and they injected with this yellow pen hyaluronic acid with methylene blue, and they figure out that first of all the yellow pens have different penetration levels, different level of movement, but also the yellow pen creates like a spot of hyaluronic acid over 3 centimeters around the place.
Wow.
So basically you get like a blood of hyaluronic acid around.
Wow.
So
that's insane. I didn't know that. Insane.
No. So for me, it's like a big no. It's like a big no. And I have had to correct issues with yellow pens. I have had to dissolve fillers, and it's insane.
Wow.
No, for me it's a big no.
We're gonna get cut off in a minute because we've reached the hour mark on Instagram.
Oh.
So we're gonna have to love you and leave you guys. I'm sorry. That was fun. We should do it again. You've got a lot more to say.
Yes. So that was very fun. It was very, very fun.
Yeah, I know. So I'm gonna end the stream and we'll go over to YouTube for a moment. Yeah. Bye, guys.
Bye, guys.
Okay, so we're still on YouTube. And he's totally ignoring me, so I'm just gonna finish the stream. But I think we'll have him on again at some point because he was good, right?